Hey guys, welcome back for another episode of 5-Minute EMS Review, where we give you short and to-the-point videos on different EMS topics. Today, it's the EMS medication Albuterol. Let's get started. All right, guys, so today we're talking about the medication Albuterol. Albuterol is a beta agonist, and we're going to talk about what that means here in just a second. But before we do, let's look at a couple of the brand names under which you may see Albuterol called. You might see Proventil, you may see Ventolin, ProAir, and Acunet. These are some of the brand names under which Albuterol is marketed. Now, we said it's a beta agonist. What exactly is a beta agonist? Well, let's remind ourselves that an agonist is something that causes an intended effect or action, as opposed to an antagonist, which is something that blocks an intended effect or action. So in this case, we're talking about something that causes an action, and we're talking specifically about the beta receptors. Beta receptors are part of the sympathetic nervous system, and in particular with albuterol, we're looking for beta-2 agonism, so stimulation of the beta-2 receptors in the lungs. These receptors are responsible for causing bronchodilation in the lungs, which helps open up the lungs so that we can breathe better in situations of bronchoconstriction. Now, the beta-2 action is not absolute. Because albuterol is a beta agonist, we may also see some beta-1 stimulation. And beta-1 stimulation is where we're going to see cardiac effects, such as increased heart rate, increased strength of contraction, things of that nature, where we might get some cardiovascular side effects. So just be mindful of that and know that it is possible. Now, a couple other terms that you may see. You might see the term sympathomimetic to refer to albuterol. And basically all that means is that it is mimicking the sympathetic nervous system. So sympathomimetic. I think of the word mime here. Another one that you may see is adrenergic agonist. And again, we're talking about it being an agonist. And the word adrenergic simply comes from the fact that the alpha and beta receptors are referred to as adrenergic agonists because those receptors are part of the sympathetic nervous system, which uses adrenaline and noradrenaline. So we get adrenergic agonists. And again, we're talking specifically here about the beta receptors. Now, we've already said it acts on the beta-2 receptors in the lungs to cause bronchodilation. So what's it indicated for? Basically, any instance where we have bronchospasm, indicated typically by wheezing, we're going to have the opportunity to use albuterol. And this could include asthma, that's our big one, but it could also include situations such as anaphylaxis and allergic reactions. It is contraindicated, like all medications, with known hypersensitivity. And because we can have bleed over effects onto the beta-1 receptors, which involve the heart, we do want to be cautious in patients who have known cardiovascular disease or are already severely tachycardic. Now, in EMS, albuterol is typically administered via small volume nebulizer. So we're getting it directly to the lungs via inhalation. Now, you may see patients that have their own metered dose inhalers, and you also want to be aware that there are oral forms of albuterol that are available. Typically, for the small volume nebulizer dose, it's going to be 2.5 milligrams of albuterol in 3 cc's of normal saline. Some protocols may allow you to double that in a single dose, and then there are usually allowances for repeat doses depending on your specific area. Some of the adverse effects that we want to be aware of, muscle tremors of the skeletal muscles. And this is because beta-2 agonists can also impact skeletal muscle. So it can be a bleed over effect, just like those beta-1 side effects that could include tachycardia or arrhythmias involving the heart. We may see palpitations, we may see anxiety, maybe some headache, and some dizziness as well. Now, 2 more things to mention. One of them has to do with hyperkalemia. Because of the ability of albuterol to assist in shifting the potassium in the body from the extracellular space, meaning outside the cells, to the intracellular space inside the cells, it can be beneficial in the setting of hyperkalemia, where we have a high level of potassium in the blood, which is outside of the cells. So if we can give that albuterol, we can potentially move some of that potassium into the cells and help lower the blood level of potassium. And so this is something where you may see albuterol in your hyperkalemia protocols. Just be mindful that it may need to be given in much higher doses than what you would typically do in asthma. And then one final note to think about is that some patients are on beta blockers. Beta blockers could be specific for beta 1 receptors, beta 2 receptors, or they could be generic and block both receptors. So if you have a patient that's on a beta blocker that can affect beta 2 receptors, just be mindful that that can counteract the working of albuterol. So we want to be aware of that when we go through our patient's medication history. That sums it up for us today. That's albuterol. If you have enjoyed this video covering this medication, be aware that we do have a playlist on our YouTube channel that has other EMS medications that you can dive into. You can also find some other playlists there that will give you some other topics as well. We hope you'll share the channel with anyone you may think might find it interesting, and we will see you next time.